1,000 metric tons of grains released from the strategic grain reserve, as well as rice cured from the Nigerian Customs Services, as well as other palliatives that were given to states that either experienced flood or some form of disaster. The share for each state were released to the state governments for onward distribution to the citizens. The private sector coalition, COVID, that had been quite supportive of the federal government, worked with states through the Nigerian Governors Forum to determine the quantum of their interventions, which was intended to be effective and equitable. A number of indices were worked out for this purpose. The national coordinator, again, shall also provide further distinction and the modus operandi for the distribution of the palliatives donated to the states by the coalition. The Presidential Task Force still wishes to appeal to all Nigerians to remain law-abiding and collaborate with law enforcement agencies to restore normalcy to our dear country. Humanity has been traumatized by COVID-19 in the year 2020. Our nation is not experiencing a second wave, but has been impacted negatively by the looting and arson. I will now invite the Honorable Minister of State Health, followed by the DG, Nigeria Center for Disease Control, and then the National Coordinator to update you on developments before we take your questions. Once more again, our sincere apologies for starting late. But however, I continue to thank you for your patience and for listening. Have a good evening.
Thank you very much, the Chairman of PTF, my colleagues in the task force, media representatives here present, distinguished ladies and gentlemen. As at today, we have recorded a total of 61,992 confirmed cases from 607,435 persons tested for COVID-19, while 57,465 cases have been discharged. We have sadly lost 1,130 persons to the disease. We now have 3,397 active cases as more persons are treated and discharged, with a case fatality rate of 1.8%. This is less than the case fatality rate of 2.4% in Africa and global rate of 2.8%. We are not relenting in our efforts to ensure that the case fatality rate continues to decline as we focus on improvement in case management capacity and ensure availability of equipment and medical consumables for our health workers. With a decline in the number of active cases and the number of cases on admission dropping, some isolation centers in the country are already making arrangements to rationalize the number of frontline health personnel into the reserve pool or redeployed. This will be done in a manner that will allow easy remobilization where necessary. We, however, have advised states and relevant stakeholders not to completely close all isolation centers due to consistent lack of patients, but some centers should rather be maintained. This is to ensure promptness and readiness against any surge as part of preparation against possible second wave. We are taking advantage of these low active cases to carry out appraisal and reappraisal of activities at the isolation centers. This is necessary to assess and understand areas of strength, weaknesses, available opportunities, as well as dangers. Such activities will consolidate gains while taking measures to prevent reoccurrence of errors as well as deployment of appropriate resources. We are also making arrangements for stock taking and repurposing of equipment earlier deployed to temporary isolation centers with a view to using the opportunity provided by the resource mobilization for COVID-19 response for health systems strengthening. We shall again use this opportunity to appeal to our youth to stop crashing our medical stores. Most of the medicines and medical consumables in these stores are stored under controlled environmental conditions, such as temperatures and humidity. Disruption of these conditions will render them ineffective and, in some cases, poisonous. The NCDC warehouse in Edu is used for the storage of medical and laboratory consumables and equipment. Destruction of these items will impact negatively on our response to the present pandemic. We also call on all who are in possession of vaccines, medicines, and other equipment and consumables to please return them. Those that can still be salvaged will be used, and those that cannot will be disposed of properly. I close by advising the general public to continue to practice non-pharmaceutical interventions prescribed by infectious diseases experts, including hand washing, use of face masks, hand sanitizers, and social distancing in order to control community spread of the disease. I thank you for listening.
Thank you very much, the Honourable Minister of State. Apologies would alter the format today. May I now invite the National Coordinator PTF to throw more light on what the Chairman spoke a short while ago.
The Chairman of the Presidential Task Force, Honourable Ministers, members of the PTF, gentlemen of the press, good evening. I know it's a bit late, so I'm going to just go rapidly through some of the issues that I wanted to raise. First of all, I want to re-echo the statement by the Honourable Minister of State Health that we are all shocked by the events of the last few days. Some of our warehouses do not contain food items. They contain medical equipment, they contain test kits, they contain valuable items that are really extremely important when it comes to the COVID response. And therefore, we are pleading with all those that are currently in the process of planning, etc., to desist from doing so. It's important that our assets are protected it's important that what the country has bought for the purpose of the COVID pandemic and what our donors have provided are used for the purposes that they are meant to. And this purpose does not include looting of the items. So I wanted to briefly also talk about COVID. I understand there's a lot of confusion between the Presidential Task Force mandate and that of COVID. COVID is a private sector initiative which was set up in the early part of the response as contributions to government. And the PTF has worked very closely with COVID to deliver some of our key mandates. It is important to remember that as we go into the issues of palliative supply, storage, and distribution, that this process is integrated and it's also very complex. But we also understand that palliatives need to be distributed with the greatest urgency so that the millions of struggling Nigerians receive the economic support. COVID have been a critically important partner in our response to COVID-19. Not only have they supported the country in the provision of PPEs and test kits, they've also provided technical support like the development and launch of the Nigerian International Travel Portal, which has made it possible for passengers to come into the country and to depart on international routes. COVID has also been working with state governors, the FCT and the Nigeria Governors Forum to procure, deliver, and distribute palliatives to 1.7 million Nigerians, the most vulnerable households across Nigeria. What I'm going to read out now are the facts. Food items were meant to be delivered to 1.7 million families across all 774 local government areas in 36 states and the FCT. It is an unprecedented relief effort, which actually started early on in April. The sheer scale of the food program by COVID meant that the program had to be delivered in a staggered and controlled manner. COVID worked with the states through the Nigeria Governors Forum to determine the number of households that will have these reliefs, to enable states and the FCT to provide clean and secure warehousing for the food. Only the Lagos warehouse is private property. The rest of the warehouses used have been state warehouses. It also included the adoption of COVID guidelines on how the food will be delivered, which involved state and local government committees, chairpersons, religious organizations, etc., to ensure equitable distribution of the food among the needy. Out of the 11.7 million supplies ordered, 11 million were confirmed to have been delivered. And in terms of the schedule, 17 states had 100% delivery and a kick-off exercise was conducted. 12 states had over 85% of deliveries reached. Only 8 states did not have a flag-off or formal handover of these commodities. Of the 8 states, 2 had 100% of deliveries reached, and a process for the kick-off exercise is currently in place, whereas the remaining 6 states had 68% of deliveries reached. Since the relief effort began with COVID and the state governments in early August, official flagging of and handover of the palliatives have taken place in 28 states and the FCT. And these states have been distributing food at various paces based on need. It's also important to clarify that some of these state governments have actually bought their own palliatives that they are distributing. Some states have received near complete or complete deliveries of the food items allotted to them. As of October 25th today, several states have confirmed the completion of their distribution. It is therefore quite concerning that we continue to see images of looting on the social media, given all the work that has been going on and the goodwill of the private sector towards supporting the COVID response. We do understand, of course, the underlying issues, but we continue to ask and we continue to plead with the general public to exercise restraint and allow this process to conclude. At the PTF, we will remain focused in dealing with the pandemic. This is our mandate, and we will not be distracted. And we plead with the public to please continue to work with us, as well as our private sector partners and the state governments, so that we can get on top of what is clearly a major issue, not only nationally, but globally, and that continues to challenge our governments across the world. Thank you.
Chair of the Presidential Task Force and Secretary to the Government of the Federation, Honorable Ministers, my colleagues, gentlemen of the press, good evening. You might have noticed that in the last week, we paused on some of our social media activities, especially the daily sharing of numbers every evening. We did this as a sign of respect to those who have lost their lives and who have otherwise been affected by the very painful event.
Service of the NTA.
I like to live my original. You should know where to go. The SOS.